I'm so excited to speak to our guest today. She's a nurse practitioner that specializes in aesthetics. She actually is located in New Jersey. Please help me to introduce aesthetic injector, Nichole.
Hi, everybody. I'm Nichole Varga. Nice to meet you.
Thank you, Nichole, for sitting down with us today.
Of course.
Awesome.
Thank you for having me.
No worries. No worries. Now, let's go ahead and dive right in. I'm so excited to ask you so many questions because you live in a totally different region than where I'm at. I'm in South Florida. It's like the mega hub of, I feel like, of everything aesthetics. But tell us, where are you located right now?
So I am located in northern New Jersey, about 30 minutes away from the city. And I have worked in a couple different regions. So I've worked in DC area and Las Vegas. So I do understand the whole regional area being different in the aesthetic market.
Nice, nice, amazing. And tell us a little bit about the aesthetic industry in New Jersey. How is everything up there?
So I recently moved here in November. So I'm still sort of learning some of the market. But so far, my clientele has mainly been an age range of anywhere between 35 till about 65 years of age.
Nice,
So
nice.
it's becoming a lot more of the millennial and the younger population, more for preventative versus corrective.
Yeah, no, that's what I see all the time. Like just going in these offices and seeing their clientele and stuff. I see exactly what you're saying. What type of, so are you getting more millennials in your offices, or is it, I know you said 35 to 65. Do you get any millennials in your offices?
So I do. And I did just recently have a job change. So I have a feeling like the way with their marketing plan and the actual aesthetics of the practice, I believe I'll have a lot more millennials or a lot more younger population starting around age 21 to probably about 40. I think that'll be the main target
Wow.
zone. You know,
Wow.
it just really depends on the practice, the location of it, because, you know, every area is going to be a little bit different of that market. It's going to be, you know, I'm going to be located in Jersey City, Hoboken. So I think that's a lot younger population versus farther west, you're going to have a little bit older population.
Nice, nice. Okay. Now you've been in the aesthetic industry for 7+ years. Tell us, how did you get started in that? Kind of what made you want to get in this industry?
So I think I've always been pretty lucky as far as being in the right place at the right time.
Yeah.
When I was a little girl, I always was self-conscious about either acne or hairy legs. So I was lucky enough to where my mom had signed me up for laser hair removal and chemical peels. And the practitioner was a nurse who was performing the procedures, the hair removal. And I was like, oh, you know what? I would love to do this. And I have a family friend, her mom tells me that's what I used to say all the time. I don't remember saying it, but I think it was like some sort of like destiny that was supposed to happen. So when I received my actual nursing degree, my RN, I was lucky enough to get hired at a nationwide company who was at the time only doing laser hair removal. And I was there for 6 months doing hair removal. I pretty much mastered that. And luckily they started to incorporate injectables, cool sculpting, skin tightening devices, IPLs and lasers. And I was lucky to get transitioned into the training program on the injectables. And ever since then, I've kind of excelled and grown from there and have much more wider, broad idea of like what to do in the aesthetic industry as far as treatments and patient outcomes.
Wow, that's great. And I always like to ask that because I want to see what kind of got you into the industry. And some people are really connected, like you said, and it shows like when you're younger, what you're looking at, what you're viewing, like as far as like career paths when you're transitioning. So that's amazing.
Well,
Truly
you know,
amazing.
too, everybody always asks me as well, like if I've worked in the hospital. I personally have never worked in a hospital.
Yeah.
I have gone through my RN associates, my BSN, and my master's, all to continue in the aesthetic industry. where a lot of
Wow.
injectors are coming, they're coming out of the hospital, they're getting a little
Yeah.
bit of the burnt out, the fatigue. But I've been in this side of nursing now for so long. I worked in a nursing home for about
Wow.
3 years as a LPN, and then since then I've been in aesthetics.
All right, nice, nice, nice. That's great, 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 great. Tell us a little bit about being a provider for so long and been in the industry. I'm sure you've seen so many new techniques and things of that nature. What advanced procedures right now are you practicing by chance?
So my favorite now is using Sculptra or hyperdilute radius in the lower face, so such as your neck, your décolletage, off label for the booty, skin tightening with hyperdilute radius. A couple years ago, no one ever really diluted the product or, added a thinning out agent to a filler because we always thought that that would possibly cause an infection. But now we're seeing such amazing technique with using it for skin tightening without adding volume. So that, certain areas you don't necessarily want the volume, especially in your neck and your décolletage. So you're using these products to really kind of induce a collagen stimulation with the filler itself.
Wow, wow. And I love how you said that because it's like it is practicing medicine and learning and growing in new techniques.
Mhm.
How far have you seen the industry come since you've been practicing?
Well, when I actually got trained in 2014 in injectables, there was only two Juvederm products and two Restylane fillers. We are now up to 22 fillers that are FDA approved in the United States. So when I first learned, we really focused on the lower face, your nasolabial folds, your marionettes, and your lips. And then within a year from there is when Voluma got FDA approved for the mid face. And we started redirecting our treatment plan and the outcome of treating the lateral aspect of the face versus filling in the central area. And that has, changed as far as how we approach our techniques for, enhancing that face versus, changing the actual face shape of the person. It's more of trying to enhance the cheekbone or trying to enhance the lateral jaw, or even now we're up to the chin projection. And that's the chin just recently came around probably about a year to 2 years ago. But before, I was never experimenting with chin. But now it makes a huge difference in changing that little bit of profile on how somebody looks.
Wow, wow. Yeah, it's more like a facial balancing type of approach, I would assume.
Yeah, it,
Yeah.
and I think that's really everybody is so fearful of changing. And we know what has happened in the past, whether it be with celebrities or somebody that it's the approach that we took is we always filled, and now it's more of using the filler to actually enhance an area versus overfilling it. And now we want to incorporate skincare lasers, treatments to actually improve the skin quality versus let's fill it, let's fill it, let's fill it.
Nice, nice. Are you practicing PRF? I'm sorry, PRF?
I do know PRP. PRF is fairly new as well. I believe it's just the way it's kind of spun. I haven't really researched a lot of it, but I
Okay.
do know that it makes an amazing improvement in, under eyes for the discoloration, trying to thicken up the skin. It's trying to slow the skin tissue from thinning versus waiting too long and now it's too thin and trying to thicken it up. So using the PRP, we're using it to stimulate that collagen, try to improve the actual skin quality.
Nice, nice, amazing. Now I know obviously broke into this industry. You had to get a job, and you had to break into there. And at providers, I get for calls from providers all the time, trying to break into the industry, trying to learn ways to get in. What advice could you give to new providers trying to get into the industry?
It takes a lot of dedication, being at the right place at the right time. I'm a firm believer that everything happens for a reason.
Yeah.
So at first, I would definitely, you know, provide your own resources. You're going to have to pay for courses on your own. Go and get
Mm.
certified. And then from there, you have to do a lot of networking. You know, go to local med spas, go to local practices, market yourself. You know, why you want to be doing this side of nursing. Why do you want to help change people's lives? What are you doing on your end? Do you have a social media? Do you continue to keep up with the trends? Do you, you know, get in touch with the reps? If you can find a local rep, because they tend to know where people are hiring or who's willing to take on a mentee or be able to take the time to train you. It does take work and dedication, but if you put that hard work in, that med spa is going to acknowledge that and see that. And, you know, don't just show up to the med spa and say, hey, this is who I am, and then leave and then wait for a year
Yeah.
to contact them again. Be on top of them, kind of annoy them a little bit, because then that shows you that you're dedicated and that shows that you're willing to learn and you want this job.
Yeah, no, I couldn't agree more. It takes the dedication and the passion to really persevere, especially when you're new, because it's an investment to learn these things from a
Mhm.
practice standpoint. So,
Right. So last year I spent 5,000 of my own money in
wow.
trainings. This year I already have planned to go to Switzerland, and that's 6,000 of my own money that I'm using to invest in my education and learning new techniques. And you know, you do have to pay a lot more out of pocket, but you come back with a wonderful skill set that, you know, techniques are changing. The way I injected a lip 7 years ago is completely different the way I inject a lip now, and it continues to change.
Yeah, no, I definitely can understand that. Can we, I now you talked about a little bit about reps, and I wanted to dig
Yeah.
deeper into that because and I don't think I've ever asked this question, but how useful can a rep in an office be for a provider?
They become my friends
Okay.
because, you know, they have the tools for you to help you succeed. They want you to succeed as much as you want yourself to succeed, because the better you're doing, the better they are doing. They have resources for education. They have online training access. They have, you know, market tips and market trends. They see what one practice is doing might be helping another practice. So they kind of have a little insider information and the scoop of what's really happening. Not only do they have your local region, but they also have nationwide, because they connect with their other reps that they're working with to find out what's happening in DC, what works in DC, what doesn't work in New Jersey, what's working in California that hasn't come out here, how can we bring it out here? So they have like these little bit of value. They have a lot more value than we think they do, and by using their help, it helps us kind of grow on our own as well.
Wow, amazing. And that's good because I know the reason I wanted to explain that because you see all these people that you work with and you're like, well, how can they help me to grow my career? And the reps are a good way. They know everybody and everybody knows them. So whether it's the training that you just mentioned is amazing. They also do they come to your office and train you, right?
They do. So usually they will provide, like, if you're talking about MERS,
Yeah.
allergen, galderma, they typically have a specific amount that they can spend on education resources, and they outsource to an actual allergen or MERS trainer or a galderma trainer, and they bring them into your practice. Or
Mhm.
you might even go to another practice to other network with other injectors at the same training, and you're learning from like a little team of people to provide these skills and learn little pearls that might be working and what doesn't work.
Yes, no, I definitely can agree. I can definitely agree. In your career, have you been more of a 1099 or W-2 by chance?
I have now been more of a W-2,
W-2.
but I
Okay.
have done always.
Okay. Is there possible, and I know I didn't ask you this before, but is there possible you can touch on that just a little bit? Because
Sure.
I've been getting so many providers that ask me this question, like, can it be helpful to be a 1099? Can it be a W-2? And most of the spas I work with are 1099. So,
Right. So when we talk about financial Financially, you can make usually a lot more money as a 1099, but there is a catch to that. You have to be going into a practice that can provide you or help you grow your books. Because if you're going in and you have 1 client to 2 clients a day, obviously that's not going to be a benefit for you. So, when you are starting off, you're going to expect that your schedule is going to be very light until you grow your book. And that could take 6 months to a year. And, if you can financially afford that, then stick with it. But most of the time, a lot of people cannot financially afford having just 1 or 2 clients a day and being 1099 or commission only. The benefit of 1099 as well is that you can write things off. Well, so let me rephrase some of that, because you could be a 1099 employee and still get hourly pay. So it really depends on what base you are. If you're hourly and you're making a commission, then 1099 is perfect for you, because you can write off your driving to work. You can write off your scrubs that you purchase, all your CMEs, your licenses, things that you're purchasing to help you grow. You can write that off. But if you're going in there as a 1099 only being commission, and you don't have the book or the clientele behind you, financially it's going to be a little bit slower until you grow that side of it. As a W-2 employee, essentially you're saving a little bit of money on the employment taxes and those sorts of things. It's the tax side of it. But you also can't write things off. So if I go to a training for $5,000, I technically cannot write that off on my taxes. I can't write my education tools that I buy, or my scrubs, or those sorts of things.
Yeah, no, I definitely can understand that. And I would agree with both of those things. 1090, I know a lot of med spas tend to turn to 1099, and it can be beneficial, like you said, if you have that commission and hourly bonus hourly pay and commission already in place. But W-2s can be amazing too, because there's benefits added on and other perks.
Correct.
that comes with it. So that's great. That's great.
And you don't have to think about your taxes.
Yeah.
Whereas 1099, you every time you get that paycheck, you have to personally put a chunk of money aside for when the taxes come along. Whereas W-2, you don't even have to think about it. But
That's true.
I like both ways. It really just depends on the approach it's going to be, is how is that going to benefit you financially.
I agree. So let's talk about social media. How big has social media played a role in your career by chance?
So I use social media as education and as my portfolio.
Okay.
We don't really I don't use LinkedIn in my profession. I mean, I haven't used LinkedIn for a long time.
Yeah.
Typically, if a client wants to know like my before and afters, I refer them straight to my Instagram page versus having a book in the office nowadays, because I'm constantly adding photos to that. So it's really your portfolio, who you are. Clients today want to know who you are. Do you have kids? Do you have dogs? Do you travel? What type of person you are? They pretty much come in knowing you before they even meet you. And it's almost like they're kind of starstruck sometimes. They're like, I know so much about you and you don't know anything about me, sort of thing. But it's how you market yourself. And it's really helping the aesthetic industry, because we all have our own little technique. We're all a little different and unique. And, you might not like me, but maybe you'll love my colleague. And that's okay, because you're not going to connect with everybody. And having that network is opening those doors so that everybody gets the outcomes that they're hoping for.
Okay, nice. Have you seen an influx of patients, like with marketing and things like that, or do you feel like most of your patients are like word of mouth?
Typically word of mouth. Believe it or not,
Interesting.
Instagram is maybe more injectors versus clients,
Yeah.
because I feel like we're all helping each other in growing this market and figuring out and learning from each other. Like I said, what I did 7 years ago is different from now. And the way I learn now is sometimes on Instagram, I find a technique that I'm like, oh, I need to try this, and it works out. So I feel like it's definitely word of mouth more so than the Instagram. And maybe here in New Jersey, that might change. I've actually only had my Instagram account for 2 years.
Wow.
I really
Wow.
only started working on it, like actually really posting a lot, was about a year ago.
Wow. Wow. That's interesting. How has Jersey kind of been different from the other areas that you worked in before, like Maryland and Virginia and things like that?
So DC, Virginia area was definitely more modest. They didn't want people knowing that they had work done. They don't really talk to, I mean, this was 2 years ago. So times COVID has changed a lot. Now I
Yeah.
think people talk about it because you're on camera all the time. They're wanting to enhance their nasolabial folds because all of a sudden now the camera's making it more pronounced that you see it. So DC and Virginia was definitely more on the modest side. Vegas, they walk in your chair and they're ready to do it then. They don't want to think about it. It's just, we're doing this.
Yeah.
Uh, New Jersey, so far, it's been a lot more like consultations. Let me learn about this first. Let me think about it. Let me assess. Let me figure out financially if I could hold it. So I feel like it's a little bit more of a thought process. So like, let me hold off. Let me not jump into this. Or, I have a wedding coming up in November. I want to have a consultation now. So that's what I'm kind of seeing at this point, but it could have been the practice I was at too. So hopefully in the next 2 weeks, I might have a little bit more of an idea of how New Jersey is compared to Vegas market and DC area.
Well, it's interesting because like you had a perspective of kind of different cities. So I'm sure you got different techniques you've learned, different customers that you've seen, different things that you kind of can add to your portfolio. So that's enticing as a provider, I would assume.
Yes. Yeah.
Nice, 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 nice. Now I know you talked about continuous education. How big is that in this industry, and what continuous education courses would you recommend for providers?
Right. So education is imperative because the aesthetic industry, although it's been around for a while, we are still learning day to day on how the muscles work in the face, how do we inject Botox into the glabella. So how I treated then, 7 years ago is also different now. We're now a lot deeper into the center area and more superficial laterally when we're talking about the actual glabella complex. So if you're not keeping up or training or trying to learn, you're not going to have these new little insights or tips and tricks on how to prevent brow dropping or how to prevent the making your smile crooked when you're doing lower face neuromodulators. And if you're not keeping up with the skill set, you're not going to better enhance or better improve your patient outcomes. So I always recommend, I follow two people on Patreon accounts where they post their little tips and tricks or their mistakes that they've done or how to improve a specific outcome. Like if you've given somebody a crooked smile, how can I fix that? So I follow two Patreon accounts. I do Julie Kaplan, who is also known as Jubilant Julie. I have gone to her cadaver course recently. She hosts now a thing called Head and Breakfast, where she has 10 people come to her house, and it's a whole weekend, and we do a cadaver. And I think
Oh,
a cadaver is very important, especially, in my side of things. I've never worked in a surgery center. I've never seen somebody's face, dissected. I don't know like the true depths when I'm doing things with fillers. And it's very important that you go and have one of these things because you're experimenting, you're trying out, well, if I put filler here and at this depth, when I dissect it, I can see where I actually place that filler. And in those sorts of training aspects, you're learning the safety component to it. I have signed up to go to Switzerland in November to go get training with Julie Horn. She's a well-known world-renowned lip
yeah.
famous injector. So I'm excited about that, to learn her technique and come back to the States and be able to help provide my clients with even more enhancement of the lips. So definitely cadaver courses, lip injection courses, because that seems to be the growing trend is lips. Constantly just attend so many trainings, as much as you can get your hands on. Yesterday I went to a training and She was amazing at facial anatomy and consultation process. So my takeaways with that is going to be how I can improve my patient consultation in the room, whether it's education or safety component.
Wow, and that's a good point you also mentioned there, is not only is the education, continuous education is important, but the patient consultation, that patient experience is just as important.
Mhm.
Tell us some takeaways, if you can share some takeaways from that by chance.
Yeah. So consultation is, before, so many clients come in, they're like, I want one syringe and I want it sprinkled all throughout my lower face. Well, we know that one syringe is not going to help that client achieve the goal. So it's more of making a tailored journey too. It's not you come in one day in March and then I don't see you for another March. It's making a journey. So you come in March, I want to see you 4 months from now, and we make these tailored approaches. So with a budget too, is if a client is on a strict budget, well, let's focus on an area that's going to benefit you the most first. So we can do a full face consultation. And if you can only at the time treat your mid face or your chin, then let's focus on that. But then let's make a follow up plan. Let me see you back in 3 months when we can financially maybe help you achieve more of your goals. And then safety is, key too, to avoid vascular occlusions or an infection. So now I talk to all of my clients in the room regarding a vascular occlusion, what to see, what to look for, how to reach out to me in the after hours in the event you think that you have an occlusion, or how to prevent infection post injections, whether it's avoiding makeup, don't exercise for 24 hours, and those sorts of things. I do now take a lot more time in that consultation so the client is fully aware of what they're walking into. It's not going to the nail salon and getting your nails done. It's a medical procedure and there's risks involved.
No, I couldn't agree. I know on social media it's kind of read as like maybe something fun and lighthearted that's very easy to do.
Let me bring all
Uh,
my friends. We're going to the nail salon. It's not. It's definitely still a medical procedure. Licensed practitioners have to be performing it.
I agree. I couldn't agree more. You're definitely right. Tell us some people that you follow on social media. That'd be great for providers to follow to gain knowledge or education.
Mhm. So I follow Professor Kuntafana. I use him for all of my kind of cadaver and anatomy go-to. I follow Jubilant Julie, who is Julie Kaplan Bass, or Julie Bass Kaplan, something like that. I follow her for safety techniques. I follow Naturally Rana, and she's in Chicago. I follow her for consultation process, also injection technique, and how to correct something if you've made a mistake. I follow injection expert. She's in California with Dr. Kwok. I follow Shelby Miller. She does a lot more for tear troughs. I follow,
Wow.
yeah, there's, my whole feed is, I always wonder what somebody that's not an injector, what their social media feed looks like, because my entire feed is Botox, lips, fillers, breast augmentations, booties, all those things. I don't know what a normal person's Instagram page looks like, but it's constantly a lot of tips and tricks.
Same. My Instagram is the same thing, so I can definitely understand what you mean.
I bet
Is
some are
there?
people cars and
Yeah.
traveling, and I'm like, well, here's the next lip technique.
I'm sure you vacation. Do you vacation often? Do you go and do you have that life balance where you like, I know it's hard work a lot and learning and technique, but do you have that balance where you go and kind of go away?
I try. So before COVID, I was in Norway. I like
Nice.
to I've been to Australia. I've been in New Zealand, Hawaii, Italy, Bahamas, Mexico. So I try to often. It's just, between traveling and COVID, and my husband travels a lot for work, or he's always away for trainings. So it's kind of hard sometimes to balance that out.
Okay, nice. Well, thank you so much for sitting down with me and speaking more about the aesthetic industry. Tell everybody where they can find you and what you have in plan on next.
Sure. So you can follow me on my Instagram page. It's injector underscore Nichole with an H. So it's Nichole. And what my plans are is I'm trying to become a trainer. And I am currently helping a practice improve and help grow their practice on all their training their injectors. So my goal is definitely becoming a trainer either through Allergan, MERS, or Galderma, whichever one scoops me up first. And just keep on learning, everybody.
All right, awesome, awesome. Well, until next time, bye.
Bye.